So for my syndrome, I chose to do what's called Aldrich Syndrome. It is a mutation on the X-linked gene that codes for what's called Aldrich Syndrome protein, or WASP, which is expressed in all hematopoietic stem cells. WASP interacts with the cytoskeleton and allows for remodeling after the receptor is engaged, and this contributes to the immune synapse between interacting cells, which then affect maturation and migration of both adaptive and innate immune system cells. Patients with this syndrome cannot effectively reorganize in response to stimuli, so they are unable to protect the body from infection. For symptoms, they normally begin in infancy. There's bleeding diastasis, which is the tendency to bleed due to thrombocytopenia, which is a low platelet count, and they also have a small platelet size. This bleeding can occur in stool. It causes them to be easily bruised. They can have episodes of prolonged bleeding, and in some cases, these episodes can be life-threatening. They also have recurrent bacterial infections, again, because the body is not able to prevent those infections from entering the body. They can also have allergic reactions, such as of the skin, which is like eczema. They have elevated IgE levels, and they can have food allergies as well. The increased risk of developing malignancies does increase over time, especially within the lymphoid system, and they also are at high risk for developing autoimmune disorders and certain types of cancer later on in life. Some immune characteristics are that T and B cells are both functionally abnormal, and they also have decreased numbers of T cells. They are unable to respond to polysaccharide antigens, and it is thought that what's called Aldrich syndrome is thought to be part of a disease spectrum, along with X-linked thrombocytopenia and severe congenital neutropenia, and all of these have very similar symptoms to one another, so it's thought that they are all together as one syndrome that can affect the body in several different ways. And it occurs between 1 and 10 million males worldwide, and is even rarer within females. There's not a lot of treatment for it. There are several tests that can be done to determine if the child is affected by this and if the parents are carriers. So it's really just management of symptoms. They have antibiotics and antiviral agents administered at the site of infection, and this is to kind of help prevent the spread to other parts of the body, since the body itself cannot prevent the infection. Really, the only certified treatment is a bone marrow transplant, and this has reported to see the reconstitution of T and B cells within the body. So once they do receive a stem cell transplant, they do begin to rebuild these cells, which will help prevent the body from becoming infected. There are tests that can be done to determine if the child does have this syndrome. They can do specialized blood tests, and this will determine the platelet count and size, and then other blood tests of the immune system to check the immune cell counts and protein levels. Genetic testing can be done in the parents to determine if the WAS gene is present, and this will help the parents determine if they want to have more children, what the probability of having another child affected by this syndrome would be, and just how to further plan on if they want to have more children. And there's additional testing. It's just x-rays, skin or urine tests, just to see if there's any lung infection, skin infection, or any other infection in the body. The prognosis isn't great with or without treatment. Without treatment, it's about 3 years. With treatment, they can survive longer, but the problem is that the longer they survive, the higher risk they have for developing malignancies, which are cancers within the body. So even though the treatment does work, their body still can potentially develop malignant cancers later on in life. And these are just the sites that I used to get this information from, and I hope you enjoyed my presentation. Thank you.